is a cognitive behavioural therapist? Well, the clue's in the word cognitive. Cognitions are your thoughts, behaviours are your actions, and therapy means treatment. So basically, this type of therapy suggests that your thoughts impact your emotions, which then affect your behaviour. For example, if you have a spider phobia, your thought might be, "Oh no, the spider's going to crawl up my nose." This thought will make you feel anxious, and your behaviour might be to get away from the spider as far away as possible. So what does a CBT therapist do? No, they can't read minds. One of the things they do is to help people to retrain the brain so that they can manage anxiety and depression. In fact, CBT is an evidence-based form of psychological treatment for many disorders such as anxiety, depression, panic attacks, addictions, eating disorders, anger, and phobias. CBT is a form of a doing therapy as well as a talking therapy. This means that interventions are exercises that introduce a new way of thinking and acting and finally feeling. When a CBT therapist first starts working with a client, they help a client set realistic goals that they would like for them to achieve. CBT therapists can work for the NHS or they can work privately. A therapist working for the NHS will offer 12 sessions, whilst a private therapist can offer much more. The NHS will also offer individual therapy, which is one-to-one, and group therapy, which is where clients can meet and speak to other patients who are going through a similar experience. So that pretty much sums it up. Without a CBT therapist, people may feel alone, isolated, or unable to process their feelings.
Hi, thank you both for joining me. So James, I'm going to start off with you. If you can just tell me a bit more about yourself. What is your job title and how did you get into this career?
Hi Maria, so I'm James and I am a senior cognitive behavioural therapist and supervisor working in the NHS. I've worked for NHS for about 8 years now, mainly in cognitive behavioural therapy. And how I got into my job was after my undergraduate degree, I embarked on a funded training programme to train as a psychological wellbeing practitioner, which is funded by the NHS. And that's kind of an entry level therapy qualification where you get paid a salary as well as having the course funded to train you in cognitive behavioral techniques. And then from there, I worked as a PWP for a few years, and then I got onto a cognitive behavioral therapy training course, which is also funded by the NHS, and you also receive a salary whilst you train. Following qualifying from that training, I worked as a CBT therapist for several years. And then I got my current role, which is as a senior CBT therapist. So in my role now, I offer a lot of clinical supervision to qualified therapists and involved in service management and development.
So Free, I'd like to ask you the same question as well. Obviously, you're doing the same thing as James or something very similar to James. Did you go down the same path as him? Did you get into it in the same way as him, or did you have to do things differently?
Okay. Hello. So my route was quite different from James's route. I had a degree in biomedical science, and I didn't want to pursue a job in research or anything that would be science related. So after graduating from university, I did a few different jobs. So I was working in a drug and alcohol service as a drug and alcohol practitioner, and then I was working in a domestic violence advocacy service. I did various other jobs as well. Whilst working in the drug and alcohol service, I was working quite closely with the CBT practitioner, and I was really interested in the different cognitive behavioural techniques. So I looked up postgraduate qualifications that would allow me to also study cognitive behavioral therapy. My course wasn't funded by the NHS, it was actually self-funded, so I paid for it myself. And whilst I was paying for it, I was told that I would have to volunteer in order to see clients on placement. So I was doing that voluntarily whilst I was studying. I was lucky enough to get a job whilst I was volunteering at my local mine service. So I gained experience quite quickly, and I did things that a PWP would do, so that things that were quite typical of a PWP. My degree was part-time, so it was over 2 years. And then I qualified as a CBT therapist, and I've been working in the NHS for 3 years.
Okay, Free, I'm just going to ask you a bit of a follow-up there, because I know you didn't study psychology as part of your degree, but you mentioned there that you obviously you had to have a lot of experience and gain a lot of experience by, I don't know if it was volunteering or how you got that experience. But if you don't have a psychology degree, does that mean with experience and volunteering and doing the right things, can you still get into this career path even if you don't have that psychology degree?
Definitely, yeah. I think even the route that's funded by the NHS, they look for experience. So it'd be really beneficial if you're volunteering somewhere and you've worked with people who maybe have mental health difficulties, or if you've been in a caring profession, then you've got those transferable skills. And I think when I applied for the self-funded course, they looked for very similar things. So whilst I was applying, they were looking at the qualities that I would have that possibly would make a good cognitive behavioral therapist.
Okay.
So the volunteering, I would say, and the experience is quite important, but it's not necessary to have a psychology degree.
Okay, thank you. So James, I'm going to come to you now. There are so many mental health professions out there, and this video is basically for people that don't know anything about what it's like being a therapist or what career path to take. So is there a difference between, say, a therapist, a psychologist, a counsellor, a psychiatrist? There's so many professions that you would think do the same thing, but they probably don't. So can you just tell me a bit about those professions? How is what you do different to the others?
Sure. So I think overall, in speaking from an NHS perspective, there's around 12 psychological professions that you can get work in or train as. And it kind of depends on the approaches that they take in terms of the research that might be behind different approaches, but also how they approach mental health in general. So, for example, a cognitive behavioral therapist is trained in cognitive behavioral therapy, and that is their field of expertise. So they will be looking at the way that somebody thinks, feels, and behaves, and putting in more helpful changes there to assist somebody with any difficulties they might be having if they are experiencing mental health problems. A clinical psychologist, however, their training route is slightly different. So that requires a 3-year doctorate degree, which is funded by the NHS. Places are very competitive for that, though. But after the 3 years, you would qualify as a clinical psychologist. So I guess the difference between that and at CBT training is only a year postgraduate, or in Faria's case, part-time 2 years, versus the 3-year doctorate course to become a psychologist. Now, I guess a key difference between those is that a clinical psychologist might be trained in different therapy modalities. So they might learn not only CBT aspects, but different other different types of therapy to help. That might include family therapy or psychodynamic psychotherapy, and various others. Normally the jobs, though, upon qualification, they are paid the same. When you start as an entry level qualified therapist or psychologist, the pay is usually the same in NHS roles. You mentioned also about psychiatry. So this one is quite different. So psychiatry is based on a medical model of mental health rather than a psychological model. And that requires somebody to study medicine as an undergraduate degree and then specialize in psychiatry. So that one is quite a different route. And like I said, it's all down to the approach to mental health and mental well-being that determines what level of training is required for each of these posts. But there are also other professions that you can get into as well that are on a similar level in terms of working with people with mental health problems, and that might be training as a mental health nurse. So you can do that as a postgraduate qualification. You can also train to become a social worker or a mental health social worker, a counsellor. So counselling is often not funded by NHS. So often that's a self-funded qualification that people would apply for and do. And often people who train in counselling would work for various charities or work for themselves. There are some positions in NHS services, but most NHS funded places to be a psychotherapist are usually CBT or clinical psychology.
Okay, thank you, James. A lot of people who are looking into becoming a CBT therapist obviously want to do that so that they can help others. So how effective is CBT? What percentage of your patients come for CBT, actually finish it and feel that it was successful for them? Either one of you can answer this question.
I think in my experience, I would say in different NHS services, it might vary. So I've worked in 3 different NHS services, and in all 3, I think it's been quite different. If a service is in a borough that's quite complex and you see a lot of complexity in clients, you might not see the recovery rates that you would see in a service where maybe there's not that complexity. So I think it does vary. I would say CBT is effective because it's an evidence-based form of treatment. It works really well with specific disorders. So as a CBT therapist, we would have different set protocols to work with different disorders, and we would work with disorders like OCD, panic, depression, generalized anxiety, and CBT is proven to be effective for those disorders. There might be other mental health problems that it may not work so well with, but within IAPT we do see the disorders that it is proven to be effective for.
Can I just pause you there for 1 second? You've mentioned IAPT. What is IAPT?
So IAPT stands for Improving Access to Psychological Therapies, and it was a government initiative to help people have quicker and more efficient access to psychological support. So like Faria was mentioning, what tends to be offered in primary care IAPT services are specific treatments in CBT for specific mental health problems. And with those mental health problems, the NICE guidance, so what NICE guidance is kind of the clinical guidance of how you would work with certain problems, would outline that a first step in treatment for those mental health difficulties would be a course of cognitive behavioural therapy. The reason that is because there's a large evidence base, like Faria mentioned, to support its effectiveness in actually alleviating the symptoms that people may experience. And the reason that is because we are able to measure changes in symptoms in CBT. You know, we focus on setting goals and looking at what would be different if you weren't feeling this way, and how can we actually put forward a piece of treatment to help you get to that place. And then we can measure whether or not somebody has achieved that and made progress towards that. And if they haven't, then we can have a think about what the barriers might be for that person and what might we also need to consider to help them get to that point. So in my experience, I think that, you know, CBT is a very effective treatment for a lot of mental health difficulties, and we often see some very good results from people who do come for therapy, which is really nice to see as a therapist, because then you find that the job can be really rewarding and actually can you know, feel good about yourself as well, and know that you're making a positive difference to people's lives.
Thank you. Can you give us a bit of an insight as to what a CBT session looks like? So is there a structured agenda, or does it just depend?
Yeah, so CBT sessions generally do have a set structure. So we usually have about 50 minutes for a session. In a session, we'll start with setting an agenda for that session. So we might ask the client if there's anything in particular that they want to bring to that session. And then we would also suggest something that might be helpful based on something that we might have spoken about in the previous session. And then we would spend the rest of the session working on the agenda points that we've already outlined with the client. Towards the end of the session, we might typically we would be setting homework with the client. So this is something like an in-between session task that the client can work on, and that would be something that's come up in the session in relation to possibly a behavioral change they might make, or in relation to something else that they can do which helps them to understand their cognitive process better, so to understand the way that they're thinking. Again, the in-between session task that you set with the client will be something that you and the client both decide on. It wouldn't be something that you just give to the client. So a typical CBT session would look like that. I think it's important to be really flexible with the client. So I show quite a lot of flexibility in sessions. If we go off agenda because something comes up for the client that's really difficult and distressing, we can pause the agenda. It doesn't have to be set in stone, but generally that's something we do try and stick to, because again, with CBT, we're working towards goals, and having that structure allows us to work towards a goal more effectively.
Thank you. James, is there anything you'd like to add to that?
Yeah, I mean, the structure of the CBT session is kind of really at its core, really, of what the therapy looks like versus other types of psychotherapy. Like Freya mentioned, you know, we would normally set an agenda and kind of keep the session focused on what we want to achieve. And with those between session tasks that Freya talked about, is, you know, that's where the client has the opportunity to go and practice and implement the learning that they've taken away from each session. And we find that the more that somebody engages with those tasks in between the sessions, the more change they're likely to experience. So we really encourage our clients to work collaboratively with us in the session, so that they feel empowered enough to go and implement, you know, the tasks that we have decided on, to see if they're able to kind of reinforce the learning from the session and experience some change. And then the following session, what we would tend to do is make some space in the agenda to review actually how that task went, and what was the learning from that. So, you know, CBT is it's a whole learning process, really, and it's quite an active therapy compared to other types of psychotherapy. So it's much more collaborative. We're working alongside our clients, and helping them to achieve their goals in a proactive and productive way.
Next question is for both of you. You spend most of your day working with people and trying to manage their difficulties. How does that affect your mental health? And is there anything that you can do to you know, help you switch off at the end of the day?
I think what's really important when you work as any type of psychotherapist is to be able to establish your own boundaries. And what I mean by boundaries is just making sure that you have a good routine for when you finish work to refocus and, you know, be able to take some space before you kind of engage back in your own life, you know, your personal life. The reason that is because we do deal with some highly distressing and emotive content in our work. And sometimes it can be quite difficult to switch off from that. So we really need to make sure that we are looking after ourselves and engaging in things like self-care, things that we enjoy, making sure that we have a good support network around us as well. But also one aspect of being a CBT therapist is that we receive regular clinical supervision. So this is our opportunity to talk through the cases that we're working with a clinical supervisor. And in that space, we can kind of talk through any difficulties that we're having, any blocks that we might be having, make with progress with certain clients, and also a space for us to almost have a bit of a debrief about difficult sessions that we have found quite emotive or challenging, or something which has evoked a particular emotional reaction in us. We have that space to be able to talk through it with our supervisor, so that we don't feel like we are just taking on board those things on our own. So yes, I think sometimes it can feel quite draining some days if you've had quite a heavy day with certain things. But it's really making sure that you prioritize looking after yourself, and really valuing the work that you're doing, and how important it is to take that care of yourself.
Thank you. Fareed, would you like to add anything?
Yeah, I completely agree with James. I think the self-care aspect is really important. I would say that in all 3 NHS services that I have worked for, not sure if it's the same for you, James, but I've been advised not to book more than 5 clients a day and to keep my diary set out, so I've got a bit of space in between each client. And again, that just gives you a little bit of a breather, a little bit of time and a little bit of space for yourself just before your next session. And before your next session, it just means you can fully commit to that client for another 50 minutes. Personally, I found that to be quite helpful.
I'm glad you mentioned that about the 5 sessions a day. So does that mean you have quite a healthy work-life balance, because you don't go beyond that?
I would say IAPT is generally a fast-paced, busy service. So if you're seeing 5 clients a day, throughout the day, you are working quite hard. But again, you can see 5 clients within that 9 to 5, and as long as, like James said earlier, you're boundaried with your time, then you've got the rest of the time away from work for yourself, and for looking after yourself, for doing things that you enjoy.
Yeah, I think it depends where you work and how you work. If you work in a primary care IAP service, then often you will be spending most of your day doing therapy appointments with clients, and that will vary depending on where you work, the location you work. How the service is set up will be quite different to other regions, so that will determine kind of what your workload will look like. But also, if you may work as self-employed CBT therapist, and in that sense you can take on as little or as many cases as you can, depending on whether you work part-time or full-time.
Thank you so much for taking part in this interview.
That's okay.
Thank you. And I think it would be really insightful for people that are, interested in psychology, or thinking about becoming a CBT therapist, or even, any other area, even if it's doing something similar. So I think it would be really, really helpful. So thank you for joining me and taking part in this today.
That's okay.
You're welcome.
I would have one word of advice. I think for somebody who's starting out, I think like Fareed mentioned at the very beginning, I think gaining as much experience as you can, whether it's voluntary, whether it's a paid job in the mental health field, is always really valuable. And also look at different schemes that might be available to help with that. Some services offer particular schemes for young people getting into the field of mental health, and they might offer certain apprenticeships to help gain skills in mental health field. And also some places offer specific apprenticeships for people from a BA/ME background, to help diversify the workforce and allow everybody the opportunity to gain the work experience, which is so valued. Once you get some of that work experience, then you can start applying for different training courses and likely get a place after having some of that experience. So like Fareed said, also you don't, for CBT therapy in particular, you don't necessarily need to have a psychology degree. It's the experience that you gain after your undergraduate degree which is really important, and demonstrates the skills that might be needed to train in this field. The courses are very good, so they do equip you with the skills needed for the job.